Good morning, sir. I'm Princess Dayan Almudal. Today, I'm going to demonstrate the administering oxygen via nasal cannula and simple oxygen mask. It aims to deliver low to moderate levels of oxygen to relieve the hypoxia, to allow uninterrupted delivery of oxygen while our clients ingesting food or fluid. So now, let's proceed with the procedure. So in preparation, we have an assessment. So we need first to assess our client with their skin, the mucous membrane, color, and also their breathing pattern. And also the chest movement and the chest wall configuration, also the lung sound that is audible by auscultating the chest. So now we're going to check it using our stethoscope. Now we're going to check using the stethoscope. And if there's a presence of clinical signs of hypoxia like anxiety, decreased level of the consciousness, inability to concentrate, fatigue, cardiac dysrhythmia, cyanosis, dyspnea, those are the signs of hypoxia. So now let's proceed in our planning. We need to assemble and prepare the equipments that we need. So we have the nasal cannula. We have the mask oxygen, which includes the oxygen concentration 40 to 60%. We have the oxygen tank. We have the flow meter, the humidifier. We have humidifier in distilled water with high flow oxygen therapy. So we have the smoking signage and the tape if necessary, and also the gloves. Now let's proceed with our implementation. So the first thing that we need to do is to check the physician order to the oxygen to ensure includes the method of delivery, flow rate, and also the titration of order for us to identify the client. So now we're going to check the physician's or doctor's order. Now we're going to perform the proper hand hygiene by washing our hands with clean water and soap. Proper hand hygiene controls the spread of microorganisms or the infection. Then we're going to rinse with clean water. We're going to perform the proper hand hygiene to control the spread of the infection in microorganism. And also we need to wear gloves. Identify our client, then proceed with the 5 rights. So, hi ma'am, I'm Princess, your caregiver for today. May I know your name, ma'am? And then your birthday? Okay, thank you. And now we're going to proceed with the 5 rights. So, of medication administration, which is the right of the client, right drugs, right route, the right dose, and also the right time. And then we need to explain the procedure to the client, explain that the oxygen discomfort, and also we need to inform the client concerning with the safety precautions associated with the oxygen use. Then assist the client into semi-polar position. So ma'am, I'm going to position you into semi-polar position. I'm ready. I'm going to position you into semi-polar position. So in administering oxygen via nasal cannula, we need to insert the flow meter in oxygen tank. So this is the flow meter. We're going to insert the flow meter into oxygen tank. Then get the oxygen tubing put it into the nozzle part, which is located at the lower part of the flow meter. But you can also insert the oxygen tubing to the humidifier if you are going to use the high flow oxygen therapy. So we're going to put the oxygen tubing, and then you need to turn on the oxygen. So this is the oxygen tubing. So this is the oxygen tubing. And then we're going to turn on the oxygen. The flow meter, put it in prescribed oxygen rate. Make sure that the oxygen flowing to the oxygen tubing. Then put the prolongs, and then you need to make sure that there's an air which is in oxygen. So now we're going to check it. Then put the prolongs to the nearest to the oxygen tubing behind the ear. So now we're going to put the oxygen behind the ear. So now we're going to put the oxygen behind the ear. Actually, there is adjustment of the chin. Ask the client if he or she comfortable with. By simple oxygen mask, we need to insert the flow meter to the oxygen tank. Attach the oxygen tubing to the flow meter. If you are going to use the high flow oxygen therapy, you need to attach the oxygen tubing to the humidifier. So we're going to attach the tubing. Then turn on the oxygen with the prescribed oxygen rate. Now we're going to turn on. So now we're going to turn on, and then now we're going to put the mask to the face of the client by placing it from the nose to the chin. Evaluation, we need to assess the proper function of the equipment to observe the client's initial response to the therapy. And also, we need to monitor the continuous therapy by assessing the pressure, areas on skin, the client, nearest every hours, and then rechecking the flow, checking the client nearest, and then checking the flow rate every 4 hours to 8 hours, and also to follow up based on the findings that deviated from the normal client. Then we can relate the findings to the previous data, then identify the unexpected outcomes. Then we need to record and report all the patient information of the procedure that we did, and then record the pre-procedure and the post-procedure vital signs of the client, and also we need to document for the evaluation.